Hi, welcome to another edition of Bringing Hope to Alzheimer's. I'm Anne Fraser, and I am so excited for today. I have one of my doctors. This is Dr. Stephanie Joseph, and she's with the Amen Clinic. She is out of the Dallas Clinic. There's multiple clinics around the United States. So welcome, Dr. Joseph. How are you?
Thank you so much, Anne. It is a pleasure to see you again. I'm doing very well, and I am looking forward to speaking with you today.
Absolutely. I'm looking forward to talking with you too. I think this is going to be maybe one of my favorite podcasts because this just is such great information. And ever since I started with you and the Amen Clinic a little over a year ago, I think this has probably been the most compelling evidence that shows how important brain health is. So now, tell us a little bit. You're a doctor of psychiatry, so just give us a little bit of a rundown on your background and what brought you to the Amen Clinic.
Absolutely. So yes, I am a psychiatrist, and psychiatrists are mental health professionals. I am a licensed physician, so what that means is as a mental health professional, while I will diagnose and make assessments, I am also licensed to be able to treat. At Amen Clinics, our approach is quite comprehensive, so we incorporate a lot of things, but for some, in severe cases or different scenarios, we may need to include medications, and so I'm also licensed to be able to prescribe medications when needed.
How long have you been with the Amen Clinic?
So I've been with Amen Clinic since 2022. I came here right after training. I am a board-certified adult psychiatrist and also addiction psychiatrist. And one of my favorite mentors was a physician at the Amen Clinics, and she told me about it. And I was like, this sounds like what I've been missing. We are talking about lifestyle. We are helping people improve their diet. We are helping people improve their sleep. And so many people are struggling with sleep and don't recognize how sleep can really impact their brain health. So we are really focusing on how individuals are taking care of themselves. You mentioned I'm in Texas, so hydration comes up so much, especially in the summer and winter. We also can incorporate different supplements. So while we'll see individuals who may have depression, sometimes they may have vitamin D deficiency, and we can make recommendations on that. And then, of course, if we need to recommend different therapies or medications, we can do that too.
Very good. And Dr. Daniel Amen is really well known in this space. He's written many books about all kinds of things to do with the brain. And one of the things I wanted to just kind of get out there, a lot of people, you think of psychiatry and you only think of somebody who has maybe schizophrenia or someone who has some really major mental issue. And I think that's one of the things that people don't understand, that it's so much more than just that. It's so much more. So tell everybody a little bit more about psychiatry in general and what that has to do with health.
So one of the unique things about Amen Clinic is that for our comprehensive approach, we incorporate Spect imaging, where we actually get to look at the brain. And this becomes important not only for those who may have severe mental illness, which we can absolutely help with, but also for those who may feel like they're doing well and want to see, how can I optimize my brain health, or how can I check in and see if there's anything going on that maybe I'm not aware of yet. Where using Spect imaging, we are able to assess brain activity and see what areas of the brain may not be working well enough, may not be getting enough blood flow, but also if there are areas that may have increased activity. And so within psychiatry now, in targeting total brain health, we can treat things from very severe mental health psychiatric disorders to really working to optimize brain health. For example, when we get to work with individuals like yourself who are true brain warriors and trying to do everything you can to make sure that your brain is in its optimal health.
Right. And that's one of the famous sayings that Dr. Daniel Amen says is, how do you know unless you look? And so looking at the brain through Spect is really important so you actually know what you're dealing with. And that's what brought me to you all was when I got my diagnosis of early onset pre-Alzheimer's or MCI, and I've been working now for 7 years, I wanted to see my brain and make sure that what I'm doing is working and what areas do I need to improve on still. Because you have to have a diagnosis from a doctor to go to a neurologist, and then it's all, for me at my age, it would all be on my insurance and I can't pay cash for it. And so I had to seek out other options to be able to look at my brain and know that my brain is responding to what I'm doing. I know that it feels that way in the testing that I do on paper, but I also wanted to look at my brain and make sure that what does it look like on the inside, right? So that's been really helpful for me. So explain to me, what does SPECT stand for?
So SPECT stands for single photon emission commuted tomography. It is a specific type of imaging that we use where we are measuring the blood flow, and then we're able to see pictures that help us to now translate that information from the blood flow to the activity in certain areas of the brain.
Very good. So I just want to explain when I went and saw y'all and got my scans. So it's a 2-day experience. So you go in on one day and they put you in a room and they give you an IV with some fluid in it. And what does that IV do again, that fluid?
So when you come in, we administer what's called a tracer. And it's basically how, when you go into the scan, we're able to measure that blood flow by monitoring that tracer as it goes through. So most people, they will do the scans on 2 different days because we're doing 2 different types of scans. That first day is typically going to be in the state of concentration. We have you work on a task, and then we administer the tracer so we can see the uptake of that tracer while you're focusing on something. Then the next day, we'll do the scan in the state of rest. So we'll administer the tracer while you are sitting, hopefully relaxed, but then we'll be able to monitor the blood flow in that more relaxed state.
Nice. And one thing to put people's fears to the side, because some people think about like a CT scan of their brain and they think they're going to be in a tube all closed in, and this is very open. The scanner is open, and I just have one thing that kind of goes around the head, but there's open parts, and I'm fully out in the open. And so I think that's nice for people to know, because I didn't know what it was going to be like.
It is much more comfortable than individuals think. I've had an MRI done, and that was not fun. I had the Spect scan done, and that was very chill. You just had to lay there and be still. And you can see everything around you. You feel like you can breathe. So it's much more comfortable.
Absolutely. Yeah. So the Spect scan, I mean, a lot of the books that Dr. Amen has written about these scans is he's looking at, let's just use, for instance, ADD or ADHD. I think that's one of the ones that was so surprising to me, that somebody, a teacher can say, you know, your child is having trouble sitting down, they're having all these problems, they have ADD or ADHD, and but again, how do you know unless you look? So the Spect scan actually will show if a child or a person has ADD or ADHD, correct?
So there are patterns that we will see for individuals who have ADHD. ADHD is known as a dopamine deficient disorder, where it will most commonly affect our prefrontal cortex. And that's basically like our inner boss. It tells us, hey, stop, don't do that. Or actually, yes, this is what we need to do, even though we don't feel like doing it. And And for some individuals with ADHD, it can be more difficult to self-regulate with tasks. And so with Spect imaging, we will often be able to see decreases, for example, in the prefrontal cortex that will correlate with it. The other thing that I really appreciate about Spect is that sometimes in ADHD, it's not just ADHD, where there may be other factors at play that are also interfering with one's ability to be able to focus. And Spect really does help us to be able to better see which thing we need to prioritize in our treatment plan.
Right. Very good. So let's talk about the other things that you'll see in these scans. So I know you have some examples, and if this is a good time for you to show these examples, but these are some of the things I was blown away when I was, again, looking up the Spect scan and looking at whether it's what Lyme's disease does to the brain, or what marijuana does, or opioids, or benzos, or different lifestyles, like somebody who's eating really bad food and has, a lifestyle where maybe there's alcohol involved or smoking. What that does to the brain is crazy when you look at the scans. So do you have some scans for us to look at today?
I do. Let me share my screen. So the first thing I'll share with you is just a healthy scan. And with Spect imaging, we're going to see on a healthy brain that things look like they are equally distributed, indicating an equal distribution of blood flow. What we're looking at right now is called a surface view, so looking at more the outside part of the brain. And we're looking on this one to see if there are any decreases in blood flow. And this is really important for a lot of different things. When we're talking about ADHD, when we're talking about cognitive impairment, disorders such as dementia, but also when we're talking about different things that might be going on in the body that can affect the health of the brain. For example, toxic exposure. There's a lot of individuals who may be exposed to mold or other environmental toxins, and we'll see decreases. There are also voluntary toxins, such as alcohol, which can also potentially harm the brain, where we will also be able to appreciate decreases. In addition to, if someone has a vitamin deficiency, low oxygen for some reason, low iron, low vitamin levels, we'll usually be able to see patterns on the surface scan that will indicate that. And it is oftentimes going to be represented by any type of indentations, cracks, or holes. And when we see holes on the scan, it means that the blood flow has significantly decreased by at least 45%. Based on, when we see holes on the scan, based on our current calculated model that we're using, that means that the blood flow has decreased by at least 45%.
Okay. So this is pictures of the top, the bottom, and each the right and the left sides of the brain. And this is a normal scan. And for what age? I can't quite see the words on the bottom, but is that for the ages of... So this is
for a healthy female aged 54 to 58.
Okay. So that would be someone that would look like mine, right?
Yes. A healthy scan.
Right. A healthy scan. Right. Okay. Very good. All right. So then go ahead and take us to the next slide and tell us what we're looking at.
Okay. So based off of this healthy one, now we'll look at one that is more concerning. And so
what's going on there?
A lot that you can see, right? We have a lot of indentations, a lot of holes. And this is actually a client who was suffering with substance use disorder. And so we see more of a diffuse pattern within the realm of addiction. That is oftentimes where people will struggle when it comes to impulsivity and not being able to control that pattern of use. And that also is going to affect the prefrontal cortex when it becomes more difficult to make what you know is your best decision, when it becomes more difficult to inhibit yourself from doing things that you know are not going to be the best for you. The substance of choice in this case was alcohol predominantly. And so we're seeing that diffuse pattern of decreases. The temporal lobes here are affected, which could potentially affect one's memory. It's not uncommon for people to have stories of not being able to remember what happened when they were drinking. And so you can see how the temporal lobes are affected here. The parietal lobes, which also play a role in attention. And then again, just this diffuse pattern of indentations.
And I think it's important to note, and you can correct me if I'm wrong, but the colors don't necessarily matter. The colors are just so you can see the different contours. Is that correct?
That's right, Anne. So the colors are really just helping with the 3D orientation on this one.
Okay, and so tell me this. If this person stopped drinking alcohol and really started doing a lot of healthy brain things as well as some supplementation, what are the chances of this individual's brain filling back in and becoming much more healthy, looking closer to a normal scan?
Our brains are so dynamic. That is really why we really appreciate being able to have this technology that we can use, because when we see the scans, we come up with a treatment plan. We can then look at your brain again 6 to 12 months from now to see how much it has improved. And so even when we do the scans on those 2 different days, they can look very different for some. But now we can see what is the outcome of the treatment plan. What is the outcome of making all of these healthy choices? And we'll be able to see that improvement. Not as many holes, maybe no holes at all.
And so over time, like, again, for someone with alcohol, substance abuse, like this brain, if this person came back in 6 months and had become completely sober, maybe cut alcohol completely out and started doing things to make their brain healthier, what would we potentially be looking at?
Then, in addition to seeing them hopefully feeling better and having a better mood, being more functional in their lives, we would also see a scan that more so resembled the normal one that I shared.
Okay, wonderful. So, and I think this is shocking for myself, and I think for a lot of people to see that just alcohol. I mean, is this someone who's drinking like a handle of vodka every day? I mean, what kind of alcohol abuse are we talking here?
So I can say that this was a young adult.
Okay.
So we're not talking about someone who had been drinking for decades.
Okay.
Showing how drastic the effect of alcohol can be.
Shocking. Yeah. Wow.
And so the longer that someone is drinking, the more that they are drinking, the more damage that will be done. However, the earlier we can intervene, the earlier we can come up with a treatment plan and make sure that someone is motivated for recovery and really work with them, understanding their values, understanding their motivating factors. The earlier we can create the optimal treatment plan with them, the earlier we'll see improvement in their brain.
Okay. Very good. Wow. Okay. Do you have another one for us to look at?
I do. And so our work now with your foundation is focusing on Alzheimer's dementia. Mm-hmm. What I would like to show next is a significant case with dementia.
Okay. So. This is not my brain.
No, ma'am.
Just to make it clear, this next one's not going to be my brain.
This is not your brain. But
Praise
this
God.
is the brain of someone suffering with dementia.
Yeah.
And the most common type of dementia is Alzheimer's dementia. It commonly is going to be affecting the temporal lobes here, as well as the parietal lobes, which are back here. And you can see that on this case, the parietal lobe is gone. It appears that it's gone, but that means that we have a significant decrease in the blood flow over here for this entire area. We're also seeing a decrease on this side too, for the parietal lobe. And this was someone who did have dementia.
Do you mind if I ask, what's the age of this individual?
So this was a case of earlier onset dementia, where typically we'll see dementia for those who are above the age of 85. About 50% of them can develop dementia. This was someone who was in her 60s, I believe, who had developed it much earlier than we would have expected. So there were unique things about this case, but I just want to show the specifics of how it shows on the scan. And this could be the same case whether someone is having early onset dementia or whether someone is having more late onset and advanced stage dementia later in life.
Okay, let me ask you this question, because in the work that my foundation's doing, we are talking with a lot of individuals who are really starting to have some cognitive difficulties in their 40s and 50s, like myself, and are testing even at like full-blown Alzheimer's. I've got some people that we're visiting with and giving resources to that are in their early, like 43, 45, and 47, and who are being diagnosed with full-blown Alzheimer's. Are you seeing that in your clinics?
Not very often, but it does happen. It's not very common for someone to have early onset dementia. It's typically a disorder or diagnosis that will show up much later in life. Things that could be affecting someone having dementia onset much earlier, one would be if there is a family history, so there is a genetic component to this. But two, when we're thinking about any underlying medical conditions that can increase one's risk, or lifestyle changes that could increase one's risk. For example, if the body is experiencing a lot of inflammation, we consume much more sugar in our diet, unfortunately, than previous generations have. So if we can cut back on foods that are inflammatory, it can help with potentially lowering our risk.
So let me touch on this scan one last time, because I want to pick up with what you were just talking about. But I want to touch on this one last time. What would this individual be able to make a lot of lifestyle choices, changes, and really just put all their effort into focusing on brain health? What is the probability of this individual getting their brain, those areas to fill back in, that blood flow to come back? What does that look like?
So that's really going to depend on where the individual is. One of the great things about the scans is that we can potentially see things on the scan before the individual experiences it. So in some cases, we can see where someone is at a high risk of developing dementia and maybe does not have the signs yet. In that case, we really absolutely want to make sure we are putting all tools on board where we can improve blood flow so they don't have to experience that decline. In this case, where someone has already experienced that decline, it's going to depend on how severe the dementia is. If someone has severe dementia and they're, for example, not able to take care of themselves, it can get really bad in some cases where they'll have difficulty clothing themselves or feeding themselves. And so in that case, the support system being able to help is going to be really important to help with supporting that individual and to slow down decline. For others who may be at an earlier stage in the dementia, the first thing that I've seen in many of my cases are improvement in concentration, where someone may have at first had trouble with being able to list out the alphabet just because they got distracted, or having trouble staying there to brush their teeth for the full 2 minutes because they got distracted, and seeing improvement in that attention where they can remain on task to be able to complete the alphabet or to be able to complete brushing their teeth, and then someone helping them stop to move on to the next task. So it really is going to depend on severity. Support, again, social support plays a key role in both assessing progress, assessing need for help, and in addition to providing help and supervision, as far as to know and be able to see progress.
Right. Because true Alzheimer's, by definition, typically can take 15 to 20, 25 years for it to develop into full-blown Alzheimer's, because it's such a slow progressing disease. So the fact that you could capture some things early on, I'm so highly in tune to it because of my family history. and background. But for individuals who are maybe feeling like they might go in that direction or they've got a family history, getting scanned earlier than later is so helpful to get a jump start on repairing the brain.
Yeah, don't wait. Don't wait to start making things better. Don't wait until it gets bad. Let's just really dive in as soon as we can, where we can see, is there anything that we need to block out? And what can we do to really keep you functioning at that optimal level throughout aging?
Right. Exactly. Good. All right. As far as, do you have other scans you want to share with us at this time?
The only other set of scans I had were yours. So
okay.
If you would like
let's do it.
If you would like for us to show yours,
let's do it. Show my
yours
scans.
Out.
Yep. Show my scans.
So here we have your scan, and you'll notice that these do not look near as severe as the ones I showed previously. However, it doesn't quite look as perfectly healthy as the first example. And so we've been working together. This was 2023, so over a year. We haven't got to do your repeat scans yet, so it would be great to see. I wish we had them today to show, but there were some areas that we worked on with you. For example, the temporal lobes that we can see on both days. And as you mentioned, we do the scans on both days. As you mentioned, we do the scans on 2 days. The first in the state of concentration and the second in the state of rest. We see the little decrease represented by those holes there where that light is passing through in your temporal lobes here. And then you can also see it down here, which is just correlating with that same side there where there's a little hole. And for you, that was a sign that, hey, we really need to work with you to optimize your brain health so that you do not have dementia. And you probably recall that we brought in Bright Mind. You remember that handout?
Yeah.
Where we're identifying your specific risk factors and then sharing with you specific ways to target those individual risk factors. So for family history, there can be genetic testing that we can do. We looked at your nutrition. We looked at, of course, your amazing exercise regimen. So I did not have to make any recommendations to you there. But one of the important things for you and all that you're working on and all that you're accomplishing was rest. Right?
Yes. I continue to work on that.
Right? How ironic. I'm working on
I'm working on resting. Yes.
Yeah. So that was something really key for you, is that we're not in this state where we're operating at 100 capacity all the time. We also are giving our brains time to rest, enjoy, take a breather, have a laugh. And of course, you have laughs. I'm not saying there's no joy there at all, but that we just have more chill, more time to just be. Right.
And I am doing better. I'm building that into my day. So you can teach an old dog new tricks. It's true.
Yeah. But otherwise, your scan looked really good.
Right. And the other thing that we talked about was eye-hand coordination things that I've implemented into my workout. And so what area of my brain, is that still the temporal lobe, or is that?
That is another set of scans that we'll look at here.
Okay.
And this is the active view. And on this set, we're looking more inside the brain, and we use this to highlight more of our emotional centers. And so our cerebellum sits back here. And we pull this up for reference. On our healthy scan, you see that, on this active view, the colors are now helping us to determine the level of blood flow, where the blue that you see all throughout is going to be the baseline level of blood flow. Red will be areas that have more blood flow, and white will be the areas with the most amount of blood flow. And on this healthy scan, we're seeing that in the cerebellar area, which is very small. It's less than 20% of our total brain volume, but over half of our neurons are passing through the cerebellar region of the brain. So this is the part of the brain. It helps with processing speed, coordination, and we really want to keep this part very active. And this is the part where activities that require hand-eye coordination like ping pong or pickleball will really help. So looking at your scans, we did appreciate a little decrease in that cerebellar area in the state of rest. And again, another area where I would really want to see here how brightly this is shining when you come back for your next set of scans.
Yes, because I work, so I don't have time in my schedule to necessarily, I love pickleball, don't get me wrong, but that's a lot of time out of my day. So what I kind of tapered it to what actually works in my schedule. So at the gym, I bring some tennis balls, and I do a lot of eye-hand coordination drills, whether it's tossing and catching, bouncing and catching, and then I'm throwing them against the wall and doing all kinds of different things. And that has really helped me in a lot of ways. I really enjoy it, and it challenges me. And so I've enjoyed that, and that's been something that I was able to take from this and then incorporate that into my daily life. So
that's fantastic. So proud of you.
Well, again, I'm always a work in progress, but well, that is good. Okay, so let's now talk a little bit. You started to touch on it a little bit earlier, and I want to go back and revisit, because the big thing that we're talking about here, especially with Night of Hope, is, as I've told you before, our mission statement is the Night of Hope is all about bringing hope to Alzheimer's by educating people about brain health, prevention, early detection, and the potential of reversal. And so a lot of the things that you guys do, and this is why I have multiple doctors, because looking at different things about the brain and lifestyle and all that, like my functional medicine, integrative medicine doctor and you fit hand in hand and complement each other very well in what I'm trying to achieve with my own brain. And so I think it's important for people to understand that there's different aspects of brain health. And so just one is great, but adding those other dimensions is very helpful. So let's talk a little bit about the health of the brain. You touched on them a little bit earlier, but talk to us a little bit more. Let's get a little bit more in depth about sleep, for instance.
Oh, Anne.
I know.
It's a big thing, and so many people are struggling with sleep. And as technology has developed, so many of us are really not giving our brains the full opportunity to really shut down so it can do its job, because sleeping is a whole nother job for the brain. It's where memory consolidation is happening. So that can really help when it comes to maintaining a really healthy memory with aging. And now we have these amazing cellular devices that are just on our person at all times. And many people are taking the cell phones to the bed with them. Before, some people were watching TV in the bed. Now we're watching TV, maybe on the phone. Maybe we even have the laptop or tablet in the bed with us. And those are just things that are not letting our brain know that it's actually time for us to go to sleep. And it can actually start to confuse our brain when we're thinking about what should be happening when I lay down in bed. Is it time to go to sleep? Is it time to make a phone call? Is it time to read a book? So when it comes to exercising really good sleep hygiene, we recommend that you don't do anything in the bed other than sleep, so that your brain gets really well trained to knowing this is what we do when we lay down, where it's easier for individuals to fall asleep, easier for individuals to stay asleep. Other things that can help with maintaining really good sleep hygiene is, if you don't need a nap, that you really try to limit naps during the day, that you're very active during the day so that your brain and body are more prepared for rest in the evening, that you also do things that are very relaxing before you go to bed, whether it's taking a warm bath and putting in some Epsom salt to help with relaxation, whether it's stretching. If you're going to journal, something that again is helping you to feel relaxed and calm, so maybe a gratitude journal or writing down highlights from your day, so you're going to bed with more reassuring thoughts other than worried thoughts about tomorrow.
So sometimes I have trouble relaxing at night. Oh, I have trouble relaxing at night. I lost my little earpiece. There it is. Okay. I have trouble relaxing, and so one thing that I do is I will just turn an app on. The one I use is called Breathe, and it takes me through a series of like breathing exercises and relaxing exercises, and sometimes those are the nights I sleep the best, is when I take the time to do that. And so what are your thoughts on using apps to help you fall asleep or relax?
I love that, especially apps that are providing like a white noise or quiet, soft, relaxing, because for some people, as you mentioned, sometimes it can be a little bit difficult to shift gears. So some people will tell me they keep the TV on because they need some noise to help them fall asleep. But then they're also being exposed to light, which is kind of signaling to the brain that maybe it's daytime and we should be awake. So using an app on your phone, especially if your phone is not right there on your nightstand, preferably if it can be a little bit further away, so you're not grabbing your phone throughout the night, is absolutely something that I think is good. As long as it's something that's not stimulating, you're not listening to your favorite podcast that makes you just cry laughing, because that amazing experience can be stimulating and get your brain charged up again, but something that is going to be more soothing, not stimulating for you.
Okay. So sleep is one, and we've talked about being active throughout the day, including exercise. So let's just touch on exercise and blood flow to the brain, like exercising in a way that kind of gets, I always say clearing out the cobwebs, but enough blood flow through the brain that you've really kind of opened up those areas of the brain with more blood flow. So as a doctor, tell us a little bit more about why exercise is so important, not only for your body and your heart, but also your brain.
You mentioned it there. It's healthy for your body, and your brain is a part of the body. So what helps your heart is going to help your brain. The better the heart pumps, the better blood flow we get to the brain. And so when we're thinking about exercise, I most commonly will recommend aerobic exercise. So depending on where people are with their physical abilities, we'll usually recommend, are you able to go for a jog? You can't go for a jog, are you able to go for a power walk? Some people are like, actually, I don't like walking at all. Are you able to go for a swim? You know, what can we come up with where you can get more aerobic exercise that's going to help your heart pump a little bit more, and that's going to help us get more blood flow.
Right. Very good. So we were talking about sleep, we were talking about exercise and blood flow to the brain. There's some other areas we're going to touch on, but I know that we're going to need to make this a two-parter at least. So we're going to take a break and come back tomorrow. So there's our hook for tomorrow, or to our next time, I should say. And make sure people join us, because we're going to continue in this line to talk about health and the brain. So with that, thank you guys for tuning in today. Can't wait to finish this conversation with you all next time. And we'll see you again next time on Bringing Hope to Alzheimer's.